Let's throw those pictures back up, these drawings from these 10 and 11-year-olds, because the government claims these aren't cages. Here you go. I mean, call them whatever you want, but these drawings, how children perceive their experience, looks like cages to me.
That's right, Brooke. And I share the concerns of Dr. Sarah and this Border Patrol agent. These are huge, impactful things for these children, especially as they grow into adulthood. Right now, they are in conditions that could be construed as a form of imprisonment and also a form of neglect. And we know from research and clinical experience that for children who have been exposed to imprisonment conditions or neglect, that they have higher risks of depression and suicidal thoughts as they grow older. They have a higher risk of having functional difficulties as adults, as well as worse physical outcomes. And notwithstanding the fact that they are sort of experiencing a form of trauma. So what about the possible PTSD symptoms that they will develop as they get older that changes the way that their brain processes things, their memory, the way that they interact with other people, feeling like there's no place that's safe for them in this world?
So, and the thing is, they're like floating in limbo, right? We don't know how long they'll be at any given place, and so it's hard to even think of, well, then what do you do to help them? But eventually, you know, Judy, what can be done for kids who've been held in custody to help mitigate any of what you just described?
Absolutely, Brooke. And that is part of the problem, is that these children were promised that they would only be there for a few days, and all of a sudden a few days turns into a week or more. And this is very troubling for children. Children need boundaries and structure. And so, to your point, be able to recover from all of this, these children will need boundaries and structure as they get out. They will need to be comforted knowing that they still have a safe place somewhere, that when somebody says something to them, that they can be counted on to follow through in the appropriate manner. And certainly many of these children will probably need professional intervention from mental health experts.
The former head of the American Academy of Pediatrics leader said this is truly a very dark spot in U.S. history. This will be remembered as a time when the U.S. was cruel to immigrant children. It makes me wonder, what kind of country are we that we would treat children this way? And it just got me thinking, final thought from you, when was the last time this was done to kids? Was it Japanese internment camps? I mean, just think of the damage and the repercussions.
Absolutely. Historically, there has been a repeat of these circumstances. And when we look at the long-term consequences of people who have survived that, it has changed them in many ways. And in other times, they've actually been unable to actually recover. They'll have long-term negative mental health consequences, and sometimes they're not able to hold down a job. They're unable to have loving relationships because they don't trust people. And so we certainly need to help these children as much as we can when they get out of these conditions.
Judy Ho, thank you very much.